So So to the few audience members that we have, we're going to give everyone a couple more minutes and then we're going to get started.
Welcome, everyone. Good afternoon. So, we're going to go ahead and get started. So, Mobility Matters presented by Access Link, supporting paratransit and all customers with disabilities as they are explore their travel options. Introducing the hosts, we have Michelle Styler, Access Link General Manager. We have the Acting Assistant General Manager, Namika Parker. And we have Assistant Operations Supervisor, which will be myself, Nathan Cordova. Before we get started, just some general tips. There will be a survey at the end to capture audience feedback. The question and answer section will be open throughout the event. Send questions there for hosts and to view announcements. We ask all speakers to state your name before speaking. It helps our hearing impaired and deaf audience members who may be using an interpreter or closed captioning. If you have logged in on a laptop or a computer, you can enable the closed captioning feature on MS Teams. This here is a little more guidance on turning on the closed caption feature. If you need more assistance, please do not hesitate to type in the question and answer section. So without further ado, we're going to go ahead and get started, okay?
Hello, everyone. So turn on my camera for a second. I'd like to introduce the General Manager of AccessLink, Michelle Styler. Michelle joined the paratransit team in 2016 and assumed the role of General Manager of New Jersey Transit's AccessLink Paratransit Services in 2019. She is a results-driven transportation professional with over 30 years of diverse experience in operations, policy, and planning. She's also a member of WTS, Compto, and APTA, and sits on the Seton Hall Customer Experience Advisory Board. Michelle is an active member and volunteer. She coaches softball, soccer, held the position of Bloomsbury Recreation Treasurer, and is presently serving as the vice chair on the Bloomsbury Planning Board. Michelle has a BA in psychology from Rutgers University, an MBA in finance and risk management, and recently obtained her accounting master's degree from St. Peter's University. Welcome, Michelle. Next is our host, Nathan Cordova. Nathan is currently an assistant operations supervisor in the Access Link Ops Center. He has been a reservation agent, works in the certification department before, and an assistant trainer. He wears many hats as he is on the event committee, training to be an outreach presenter, and now an event producer assisting Michelle and I today. Nathan is grateful and honored to be of service to individuals who have disabilities and challenges. He also is glad he can provide insight on accessible services. Up next is me, and I'll be assisting these two dynamos today. I am the acting assistant general manager of operations. I work with certification and the customer service and outreach groups. For over 2 decades, I have been actively involved in an assortment of functions in passenger transportation industry. I exhibit working your way up in the most wonderful way. I was a temp reservationist and now I am the assistant GM. I hold a BS in management and finance and my master's in business administration. I also am a member of WTS and on the research committee looking into the glass ceiling and why women executives can't break that barrier. I'm studying to get my PMP and be a project manager. Thank you for having me today, and thank you all for coming today. Nathan?
Thank you, Namika. So today's agenda, we will start with a welcome message from Michelle Styler with some Access Link updates. Then we will roll into the presentations from our featured speakers. And finally, we will have a short question and answer session and closing remarks. First up, Michelle Styler, the General Manager of Access Link.
Good afternoon. Thank you, Namika and Nathan and the Access Link team for setting up our first virtual Access Link conference. And thank you to our speakers, Karen, Judy, Jess, and Marco, and all of our participants. I'm happy you could join us. And I'm really excited about this event and know that we will continue to build upon this momentum. Our intent is to bring together communities, advocates, and interested parties to engage in accessibility-related discussions. How can we do better, and how can we be better? As much as I'd like to talk to you about Access Link, that's not what this is about. I'm going to give you some brief stats and a short video, and then we'll roll into our speakers. Access Link shadows New Jersey Transit fixed bus routes. The service extends to 18 of 21 New Jersey counties. We contract out our service to 2 providers that cover 5 geographic regions, a large portion of the state. We have over 66,000 customers and provided over 1.5 million trips in 2019 with 500 vehicles. I'm using 2019 as a baseline because of the impact of COVID, but I will say that our team fielded over 61,000 phone calls this past June as we are seeing our riders return. There has been investment in Access Link and it's ongoing. We've added 80 hybrid Toyota Camry sedans to our fleet in 2021 and anticipate the addition of new minibuses in 2022. We are exploring an electric vehicle pilot. The New Jersey Transit Capital Plan includes a proposed Access Link facility. We've improved our outreach and coordination efforts and will continue to collaborate with county and state agencies. And we also continue to seek technological solutions that include improved analytics, artificial intelligence, and trip brokerage. And then now I would like to start that video. If you could, Namika and Nathan.
Bear with us one moment. The video is a little slow. Hold on one second.
For those customers who are unable to take the lift-equipped local bus or light rail systems, New Jersey Transit offers yet another alternative, Access Link ADA Paratransit. In conjunction with the 1990 Americans with Disabilities Act, Access Link serves customers whose disability prevents them from using the bus and light rail systems independently. Access Link provides origin to destination rides within a defined 3/4-mile service area that correlates to the service a customer would receive on the routes shadowed by Access Link. The eligibility process includes a transportation assessment and requires medical verification. Customers who are assessed eligible to ride Access Link include those who are unable to use an accessible bus on their own or who can't reach a bus stop due to their disability, combined with environmental barriers. If you would like to know more about eligibility for Access Link service and other accessible services, call Access Link at 973-491-4224, Monday through Friday. After you have reviewed all the information, call us back and we will assist you with applying for Access Link service. Access Link does not schedule same-day rides, so those found eligible for the service must make reservations at least 1 to 7 days in advance. Reservations can be made with a live agent via the Access Link website or through the Access Link mobile app. Access Link charges a fare for each ride that is comparable to what a customer would be charged when taking the same ride on the fixed route bus and light rail systems. Exact fare is required for all rides, and customers can pay the required fare for themselves and those persons traveling with them with cash or by using our electronic fare option, Easy Wallet. Once a ride has been reserved, customers will receive a reminder notification the night before their scheduled ride and receive another notification on the day of service when the vehicle is nearing their pickup location. Pickup can occur at any time within your confirmed pickup window. Customers choosing to travel with a companion or personal care attendant must make sure they are with them and ready to board the vehicle at the time the vehicle arrives for pickup. Drivers will wait 5 minutes for a customer to meet and board the vehicle. Finally, if your plans change, a ride reservation must be canceled at least 2 hours before your requested pickup window. Cancellations can be done via our IVR phone system, on the Access Link website, through the Access Link mobile app, or with a live agent. If you have questions regarding Access Link service or encounter any difficulties while using the Access Link service, please call 973-491-4224 and select option 5 for customer service. Agents are available 8 a.m. to 4 p.m. Monday through Friday, excluding holidays. Correspondence can be sent via email to adaservices@njtransit.com. And eligible Access Link customers can also contact us via the Access Link website at accesslink.njtransit.com or through the mobile app.
This is not scripted. I'm going to jump ahead of you, Nathan, but this Access Link video is just a component of a larger accessibility video that the agency is putting together. So thank you. Nathan, you're up.
Thank you for that information, Michelle. Let me go ahead and introduce our first speaker. Her name is Karen Alexander. Karen is the Managing Director of NJ-TIP at Rutgers. She is the co-principal investigator for Understanding the Mobility Needs for an Aging New Jersey Population, which is a 2021 study for the New Jersey Department of Transportation. Karen is experienced in creating, implementing, and sustaining innovative programs to encourage independence and enhance mobility for seniors and people with disabilities. She has expertise in New Jersey and New York City regions with focus on aging in community, public transit, and accessible services. Karen is skilled in group facilitation, transportation analysis and planning, effective collaboration, and resource development. Welcome, Karen.
Thank you very much. Can you hear me, Nathan?
Definitely can.
Excellent. I'm delighted to be here today. Thank you for that lovely introduction. And you pretty much covered my background, so let's go to the next slide. NJ-TIP at Rutgers is a program that operates out of the Voorhees Transportation Center at Rutgers University. For over 20 years, VTC has provided excellent work in the areas of safe mobility, pedestrian access, transportation equity, and sustainability. In 2013, NJ-TIP, the New Jersey Travel Independence Program, joined the Voorhees Transportation Center as another area of applied research within the center, complementing other efforts such as Safe Routes to Schools, Complete Streets, and the Bicycle and Pedestrian Resource Center, other centers within VTC. Next slide, please. So today's conversation is about mobility matters, and I wanted to share a little bit with you about why mobility is so important. Fundamentally, mobility is the link between transportation and life satisfaction. And what we say at NJ-TIP, the travel training program that I run, if you can't get there, it doesn't exist for you. When we think about our mobility, if you look at these interlocking circles, there's the area you can walk or bike to independently. There's another ring of mobility that's really where you could get on public transportation in terms of what links to what you can walk to. There's a ring around that that's automobile travel, which we know you can go all the way across the country using an automobile. And in the last year and a half, we've begun to also see a fourth ring when we think about mobility and connecting people to the opportunities that matter most. And increasingly, we're also thinking about virtual connections that can complement those physical connections so that people can really get to, or the things that they want to get to can get to them, both physically and virtually. So that's definitely an outcome from this last year and a half of the pandemic in terms of seeing that opportunity. Next slide, please. So we had a great video about Access Link, and our job at NJTIP is to teach people how to use the accessible fixed route system in New Jersey. And just like Access Link has its fans, the accessible fixed route options in New Jersey also have our fans. These 4 major modes span different parts of New Jersey. They are all accessible. And they're available as Access Link is in 18 out of 21 counties. These also span much of the geography of New Jersey. And I want you to just take a second if you're on this meeting today and think, what's closest to you, to your work, to your home, to your school? Think about the last time you saw a New Jersey Transit train or light rail, a bus or an interstate bus, and just take a sec to think all of those modes are accessible and available to people with disabilities as a way of getting around. Next slide, please. So one of the things that we were very excited about at NJTIP is that the Access Link customers have, in the last year and a half or so, had access to getting a reduced fare card as part of their eligibility process. That allows a 50% discount on fixed route fares on all of those modes for folks who are people with disabilities, older adults over age 62. People with disabilities who do not apply for Access Link can also apply for a reduced fare card. But this weekend I saw Willy Wonka, the 50th anniversary of the film, and your reduced fare card is sort of like your golden ticket. It's a half-price ticket to any place you want to go that the transit system goes in New Jersey. We see that as very powerful with the people that we train in terms of making sure they have a reduced fare card and they know how to use it so they can immediately get those benefits of discounted transportation. So next slide, please. What kind of training does NJTIP at Rutgers offer? Well, we offer one-on-one instruction, meaning we work with people individually to teach them about how to walk safely in their neighborhood, how to get to a vehicle, how to board that vehicle, how to ride it safely, and then how to alight and get to their destination. And that's work that we do working closely with New Jersey Transit in terms of those one-on-one customers. We also provide small group instruction to classrooms, community centers, at public libraries, at agencies that serve people with disabilities. And we provide seminars for professionals, which we call Connect to Transit. So far, we've trained over 12,700 people in New Jersey about using public transportation through the NJTIP program. And one of the things you'd have to ask is, well, what happens during the pandemic? And I'll talk about that briefly, but basically in March of 2021, we started working on remote and virtual instruction and group trips so that we could continue to advance our mission safely following CDC and Rutgers guidance during the pandemic. Next slide, please. So I said that we do one-on-one travel instruction. As of yesterday, we had 478 one-on-one graduates since the inception of the NJTIP program. NJTIP started with a pilot in 2005, became a formal organization in 2007. As you heard, we were an independent nonprofit from 2007 to 2013, and then we became part of Rutgers. So across that arc, we've trained 478 graduates, and I'm really proud to say 7 so far in 2021. And those are people who participated in that remote and virtual instruction and then made the leap onto the bus and then demonstrated their ability to travel safely. These are the key steps in our training in terms of an introduction, an intake, a route check, onboard training, and then our instructors fade back so the client can actually be independent and travel. Next slide. So I said that we did one-on-one remote learning as part of our adaptation during COVID-19. And March of 2020 was a really busy month for us. We were told to stay home on March 16th by Rutgers University, and by April 17th, we had launched virtual training, meaning we developed all of the curriculum, the slideshows, the worksheets, so that we could get back out there, so to speak, teaching trip planning, key skills, how to use the New Jersey Transit website, how to use the Transit app and Google Maps. We used WebEx, Zoom, Google Duo. We used iPhones and FaceTime, all of those techniques to connect with our customers. We also had to find customers. We reached out to graduates that had not been exposed to these new technologies, that had graduated a while ago, and introduced them to those trip planning technologies so they'd be ready for the brave new world that we were all going into. And we worked very hard to make sure that our remote training was interactive, that we had our customers reading things aloud, doing skills and drills, doing worksheets. So it wasn't just staring at a screen with somebody talking, but actually something that was engaging. Next slide, please. One of the things we're really proud of is we developed virtual field trips, also through the pandemic. And that was really exciting in terms of creating interactive educational group activities for classrooms and community organizations, where we took them to virtual locations that were transit accessible, like Liberty State Park, the Newark Airport, historical Philadelphia, and as you can see, New York City. We did have somebody request a trip to Hawaii, and we told them you couldn't go there on transit, so we weren't going to do that as a virtual trip. But if you could get there on transit or the public transit system, Amtrak, we cheated a little in terms of Philly, and SEPTA. But if you could get there on transit, we would create a field trip and then use that as a way of teaching trip planning schools, street crossing tools using Google Maps, and how public transportation can be used to access those destinations. All of our training is based on the 27 key skills that you need to be able to use public transportation safely. And in light of COVID-19, we added 3 more skills around community safety, masking and social distancing, contactless fare payment, those kinds of adaptations, so that we knew that when folks went out, they'd have the tools to be safe. Next slide, please. So we are now doing in-field travel training for essential trips. And by essential, we mean something that's a recurring life activity like work or school or a medical appointment, and that has a time-sensitive component. You're starting a class, you're starting a new job, you have a recurring medical appointment that you go to every week or two that you need to have routine transportation for. And when we train, we're always making sure that we're following the most current, even though it's ever changing, CDC guidelines and New Jersey Transit guidelines, so that we're keeping both our instructors and our customers safe. Next slide, please. So some of the benefits of travel training are that you get access to education, employment, social and cultural activities, community engagement, recreation, so many different things. I mean, in a word, you get freedom in terms of quality of life, independence and empowerment, expanded mobility, which equals expanded opportunity and possibility. We like to use the phrase chauffeur retirement. Sometimes if it's an older adult, it can be an adult child that's providing that chauffeur. Sometimes if it's a young adult, it can be a parent whose second job seems to be driving their kid around. With travel training, those individuals can have more self-determination and more independent mobility. And I started by talking about the reduced fare card. I'm going to finish by saying cost savings. Fixed route is less expensive than paratransit. You can save 50% out of the gate, and you're working on a scheduled service as opposed to waiting for a pickup. So there's also time-saving benefits in that as well. Next slide, please. We can't do this alone. NJTIP is a small group within the Voorhees Transportation Center. These are some of our partners and our funders and collaborators. NJ Transit has been a stalwart supporter of NJ TIP in our work. We are grateful for that. We have worked with the New Jersey Division of Vocational Rehabilitation Service and Project Search over the last few years. They have also funded individual travel instruction and group instruction for Project Search students. You see a number of foundations and community-based organizations that we have collaborated with in the last year or so. And when I say we couldn't do it without you, our graduates, their families, the teachers and counselors who direct people towards NJ TIP, saying this might be good for you, that's priceless, and we value it tremendously. Next slide, please. So this is the NJ TIP team and the folks who go out and actually do this teaching in the field. Many of them have master's degrees. Some of them have educational credentials. All of them have been doing this work for a decade or more in some way, shape, or form. And as the director of NJ TIP, I am grateful for them, their professionalism, their creativity, and their perseverance during the last year and a half as we recreated ourselves in this virtual world. Next slide, please. Thank you. I am happy to have been here today. I'll be around for the Q&A. I don't know if we have time to show our 3-minute video, but if we do, I would love to share that with you. Thanks.
I'll cue it up right now, Karen.
Thank you, Namika.
Thanks, Karen. And in preparation for this event, Karen stated as good of a presenter and speaker as I am, and I'm pretty good. I think the video of our program graduates speak for itself. To hear from them all says it all pretty much. So let's jump right into the video.
Hi, I'm Karen Alexander, the Managing Director of NJ TIP at Rutgers, the New Jersey Travel Independence Program. NJ TIP at Rutgers teaches people with disabilities and older adults how to use public transportation. Our mission is to increase the self-sufficiency of people by empowering them to use public transportation safely and independently.
I am so delighted. I'm happy. The lady tip at Rutgers, she is the one that gives me this boldness to ask for her training. I'm not shy anymore. I request it immediately and they give it to me.
Participants will learn, among others, how to read schedules, plan their trips, pay their fares, taught by seasoned professionals in a one-on-one environment or small groups. During the one-on-one training, the instructor will ride along with the participant, guiding them until they are confident to travel independently. The small groups participate in class activities and escorted transit trips to popular local destinations, such as the mall, museums, and downtown centers. Currently, NJ TIP is offering remote individual training and virtual group field trips. In-person training can be provided on buses and trains for essential trips. NJ TIP trainers follow CDC guidelines along with Rutgers University and NJ Transit policies to reduce the risk of exposure to the COVID-19 virus.
New Jersey Transit, the NJ TIP program, changed the lives of many seniors here in Westwood, but for me personally, it made such a huge difference. I'm a big chicken. I don't like to travel anywhere by myself, and I had gone on the NJ TRIP training with seniors from Westwood, and the next day, for the first time, I traveled by train to go to Hoboken to babysit for my grandson. It made all the difference in the world. I knew what I was supposed to be doing because of the NJTIP program. So thank you.
Upon completion, participants feel empowered to travel on public transit safely and independently.
Well, the training has taught me how to be more confident. It gives me the spirit, to want to go out and do things more, and I don't have to depend on someone to pick me up and come back and get me. And because seniors like to be independent and travel and go as they choose.
For more information, contact NJTIP at Rutgers.
Thank you for that video. Karen has also shared some photos of an NJTIP travel training session to Trader Joe's.
One moment. I didn't queue it up, so.
You know what? Don't bother, Namika. It's okay. They've seen plenty of my stuff.
Okay, then we're going to move on to our next featured
Please do.
speaker. Thank you, Karen, again. Nathan, could you introduce the next speaker, please?
Definitely. Thank you, Karen, for that wonderful video. So our next speaker is Judy Shanley, PhD, is an Associate Vice President of Education and Youth Transition at the National Office of Easter Seals in Chicago, and serves as the Easter Seals Director of the FTA-funded National Center for Mobility Management. She manages federal projects, conducts research, and provides technical assistance regarding transportation coordination and mobility management. Judy is currently the Secretary of APTA and the co-chair of the TRB Access Committee, International Conference Planning Committee, TransEd 2022. Prior to Easter Seals, Judy worked at the U.S. Department of Education, where she wrote federal grants and monitored programs to ensure compliance with federal regulations. Prior to federal service, she was a principal research analyst at the Americans Institute for Research for 9 years. Judy has entered her PhD in special education from the University of Florida and an MBA and a master's in rehabilitation counseling, both from Syracuse University. And let's all welcome Judy.
Thank you. Thank you, Nathaniel, for that nice introduction, and thank you, New Jersey Transit, for inviting me. I'm excited to talk to you. Before I get started, I'll just describe myself for those who may have visual disabilities. I'm a white, middle-aged woman. I'm wearing glasses, I've got headphones, and I have shoulder-length brown hair. So excited to be here. I entitled this presentation, "It's Not Your Father's Paratransit Service," because as a national provider, as a National Technical Assistance Center, I get to see all the innovation out there around paratransit service delivery. And so when I was thinking about what did I want to share with you, my hope is that you'll think of paratransit in the innovative ways that we're seeing it nationally. So next slide, please. Wanted to tell you a little about my national center. It's called the National Center for Mobility Management. On the next slide, I've got our mission really is to promote customer service mobility strategies. Our hope is similar to what Karen talked about, where we want to have people have accessible transportation service so they have good health, economic vitality, self-sufficiency, and community. And our work really is about cross-sector partnerships, bringing together human services and transportation to ensure that that individuals with disabilities, older adults, and those with low income have access to a variety of transportation options that they can rely on. We're funded by the Federal Transit Administration through a cooperative agreement with the FTA, and we're a partnership across 3 organizations. One is the American Public Transportation Association. The second is the Community Transportation Association, and then my organization, which is the National Office of Easter Seals. Next slide, please. So our mission is focused on building mobility management networks across states and regions. And so you may be wondering, what is mobility management? And in short, mobility management is really about creating options. It's creating a system, ensuring that the people that are in that system are skilled in building transportation networks so that people have access, individuals with disabilities have access to a variety of transportation options. We encourage flexibility because we know that transportation service in one community may look very different than in another community, but really it's finding the right fit and the aligned transportation solutions. And of course, we want to ensure that there's sustainability for any network that is created. And the core of what we do is the customer, in knowing and ensuring that the individual rider is at the heart of the transportation service. On the next slide, mobility management is really about putting the pieces together. So it's about figuring out what all the needs of individuals and community are. Is it getting to work? Is it accessing healthcare? Participating in religious and social kinds of opportunities, and then matching those needs with all the variety of transportation services that may be in a community. On the next slide. You heard a little about me, but I come at this from a non-traditional perspective. I'm not a transportation person by background. I was working in education, and I was continuously frustrated that as I was helping youth with disabilities seek post-school outcomes, helping them get jobs, participating in healthcare, participating in the community, no one was ever thinking about transportation. So I raised my hand. I was participating in some federal interagency efforts across federal sectors to really focus on transportation. And so that's how I got there. On the next slide, please. The 3 points about paratransit that we've seen nationally, their points, their trends, is the innovation in the delivery of paratransit service. And that's what I mean by it's not just your father's paratransit service. We've seen so much creativity across the nation by transit agencies, by providers, by human service organizations working together to ensure that the service is still aligned with the needs of customers, but it's innovative. We've also seen a large push on integration of mobility, and I'll explain that in a minute. And finally, thank goodness, there's an emphasis on inclusion and universal design. So ensuring that the voices of riders with disabilities, those with low income, seniors, are at the table as systems are designed, as innovative services are implemented. They're at the table at the beginning, they're at the table during the delivery and operations of a service, and they're always informing the progress of the service. So let me talk a little about each of these 3 points. The innovation on the next slide. When I think about and talk about innovation, really I'm talking about non-traditional service. And Michelle talked about this a little, that New Jersey Transit is looking at different kind of vehicles. So not just your traditional 16-passenger wheelchair accessible vehicle, but right sizing the vehicle to the needs of the community. So if you don't need a 16-passenger vehicle, use a car, use an automobile. Also, in terms of non-traditional service, we think of new and different partners. So it's businesses that may be working with human service organizations and transit agencies to identify service. It's working with human service at hospitals and all of those different entities that have a need to ensure that patients or participants or clients are accessing those services. So thinking about new partners. We've also seen a huge increase in the use of transportation network companies or TNCs like Uber and Lyft that obviously have to have wheelchair accessible vehicles. I used to live in Chicago up until about 3 weeks ago. I live in Boston now. But up until that time, in Chicago, they've got an agreement with Uber and Lyft to provide a TNC-related paratransit service. And as part of that agreement, they negotiated with Uber to have a certain number of wheelchair-accessible vehicles, because that's always a concern, that you're going to meet the demand of riders who have differing mobility needs. The other thing that we've seen advances on is an on-demand service called VIA. The on-demand service creates spontaneity. It gives people the chance and the opportunity to schedule same-day service, which often doesn't happen with paratransit. Sometimes you have to schedule 2 days out. The reliability of paratransit service is sometimes questioned. And so the on-demand service through companies like VIA, and VIA isn't the only one, but offers flexibility and options for individuals. We've also seen integration. So the integration of the administration and the operations of paratransit. In many places, paratransit is thought of as a separate or discrete service from the range of transportation services that an agency may provide. And it's apparent in New Jersey Transit that your paratransit service is really integrated in the fabric of what the agency is providing. And that's really critical. The third piece is the voices of individuals with disabilities always guide this service. And I'll share some examples with you about places that's happening, and, having advisory committees, having and employing people with disabilities who are decision makers in the service is really critical. And I'll just read 2 quotes. One, the public sector and private mobility operators are eager to collaborate to improve paratransit using emerging approaches and technology. And the second, a number of business models are emerging that include new forms of public-private partnership for the provision of mobility and related information service. So we've seen technology play a critical role in the advances of paratransit, and we've seen more partnerships, both public-to-public partnerships and public-to-private partnerships. And on the next slide, I offer you some examples of the innovation that we've seen and how influential, and Michelle mentioned this too, the influence of technology on scheduling, on being able to coordinate service, the GPS and the flex kind of technology that can be used to track vehicles so that people could have more real-time service is all been instrumental to creating a new kind of paratransit delivery. And this is an example of new paratransit service that's happening in Virginia, it's happening in Texas, it's happening in Missouri. So rural and urban areas are really taking advantage of these new technologies and the innovation it creates for paratransit. On the next slide is an example of integration. So this is the MBTA system in Boston, and you could see that when they're talking about the ride, which is their paratransit service, they're integrating it in all the other options that individuals might have. So if you're looking for the subway or the T system, you also have opportunities to look at the ride. It's not a disparate service. It's integrated into the range of service that the agency, and in this case, it's the MBTA, offers. On the next slide is an example of providing individuals with options. So people with disabilities, older adults, could be spontaneous. This is the Connecticut Mobility Choice Program. It's on the DOT website in the state of Connecticut, and it just provides a lot of options for people. So maybe the individual is eligible to use paratransit service during certain times, but they also want the flexibility and the options to use other services that agencies might provide. So Connecticut is really engaging and inclusive of individuals with disabilities by creating this mobility choice program. Boston also has, they had received funding from the Federal Transit Administration called the Provider Options Pilot, and it was an opportunity for a rider with disability to choose the particular transportation service they want to provide, whether it be a Lyft, whether it was a taxi service, or whether it was a traditional paratransit service, but that gave the rider choice in the mobility options that they have. On the next slide, please. It's all about being at the table. I mentioned having individuals with disabilities, older adults, low-income individuals to be decision makers. And the Utah Transit Authority has really nice programs where they're using public outreach to engage diverse audiences. And the outreach they provide is universally designed so that regardless of the learning style, whether someone has a cognitive disability or a sensory disability, they're able to engage in the planning and the operations of that service. I want to just provide that example to show you how transparent the services could be. And if you're a provider, if you're a transportation provider in your community, or if you're working with transportation providers, ask them about how they engage individuals with disabilities and older adults, and ensure that the way that they engage people is really transparent. So on the next slide, I talked about mobility management as just building partnerships. And this is a picture of a tiger nestling up to a chimpanzee, and the caption reads, "Always try to build connections to support transportation engagement, unlikely sources." So for those of you who are in human services or healthcare, maybe you've never knocked on the door of your transportation providers. Maybe you've never gone to a New Jersey Transit meeting or interacted with transportation professionals. This is an opportunity to do that, because your interactions, your relationships, they're unlikely. They may not be customary to you, but those relationships can ultimately help the services that transportation services that are available to the individuals that you work with. On the next slide. There's national technical assistance centers that offer free information, like my center, the National Center for Mobility Management. We're free. We provide technical assistance nationally, as do many of these other national FTA-funded centers. I encourage you to go to the websites, learn about the kinds of services and materials and products that we provide, similar to national technical assistance centers that may be available in other industries. These FTA centers are a wealth of information, and many of them have grant programs. The Federal Transit Administration is really big on ensuring that the money we get as a national provider goes to the local level. And so many of us have grant programs that you may be eligible to apply for. So you can find out about those grant programs at each of these sites. And then the last slide is my motto. You know, I'm always about innovation and change. And this is a quote in a book that I read called Fierce Conversations, a quote by Susan Scott. "If you always do what you've always done, you'll always get what you've always got." So let's think a little differently. The cliche is thinking out of the box, but develop new partnerships, learn about the transportation services in your community, and be a decision maker at the table, and encourage the individuals you work with to do that. The last slide is, on the next slide, is my contact information, I believe, and I'm looking forward to having Q&A, and please follow up with me if you have any questions or need further information. So thank you so much for inviting me.
Thank you, and Judy, for that insightful presentation. Appreciate it. Now on to our third featured speaker. I'd like to welcome Mr. Jess Segovia, also known as the ADA Guru. Mr. Jess Segovia is an accessible public transit professional specializing in ADA compliance, training, and mobility management. Jess has been creating and operating compliant, full accessible public transportation services and operator training programs since 1999. In addition to ADA compliance and operator training, Jess's expertise includes subrecipient oversight support, DBE, SBE, goal achievement services, customer education and public outreach programs, NTD reporting, accessible website design and compliance, FTA triennial review preparation, and ensuring accessible public transit facilities. Take it away, Jess.
Thank you very much. Hopefully you can hear and see me okay and see the title slide that I have there. So it's an honor to present to all of you today. ADA compliance can be a very complicated issue. I think it scares a lot of people, but what I do in my work and in my trainings is to help teach a philosophy. We can't all necessarily remember every single regulation that is present in the ADA, but I help agencies develop a philosophy for providing services, taking into consideration the needs of the customers, safety, agency policies, of course, ADA regulations, and to build a culture of accessibility within the organization so that if an operator is having an interaction with a rider, they may not know the exact regulation or requirement or policy that they need to follow, but if they take safety and customer service, etc., into consideration, then they almost always make the right decision. So that's sort of my expertise, helping transit agencies not only meet their compliance requirements, but to identify where they are already exceeding the minimum requirements of the ADA, as well as helping them sort of smooth out their services and to change the culture within their organization. I just worked with a couple agencies in South Carolina, PDT RTA and Coast RTA, and it was a great experience, and they've provided some feedback stating that they're already seeing a shift within their organization's culture. So I'll be talking about ADA compliance challenges in public transit, really from both the customer rider experience as well as from the operator or transit agency experience. And so normally my ADA training is 5 hours long, so I've compressed it down to really identify those key areas where either transit agencies are sort of struggling to meet the needs of the rider and where riders might be having some challenges, perhaps needing some additional assistance, things like that. And so hopefully this information will help you no matter what side you're on. If you represent customers and you have clients that are people with disabilities, perhaps this information can help educate them further in creating a realistic expectation of public transit. It's very important that we do that. That's some of the other work that I do as well, writer's guides, content for websites, trying to create a realistic expectation of what public transportation really can do for people with disabilities, and then what it cannot do. Very important as well. Quickly about my background and experience, I began my career in Los Angeles with Access Services, very large ADA paratransit agency. Was there almost 10 years, and it was a great introduction into public transit and into understanding the needs of customers with disabilities. One of my roles there was sort of in reverse marketing to help make all of the fixed route services around or in the service area, how to make them more usable, more accessible for people with disabilities in order to reduce demand on the ADA paratransit services. And then most recently, I was the ADA compliance manager for Metro in Los Angeles. I was there approximately 5 years. That was a great experience, living and breathing ADA compliance all day in a large urban agency. And you know, the only way to tackle the size agency like Los Angeles Metro is to break it up into small pieces. And so I didn't see it as one large agency. I saw it as maybe 15 smaller communities within that agency. And then I tackled the challenges for ADA compliance and to try to make the agency as accessible as possible. That was the CEO's challenge to my department. So great experience there. So we know that there are many challenges facing customers with disabilities. They may need some general assistance like boarding and exiting vehicles. It can be confusing to use fixed route services, and so if due to a disability, a person does have some confusion, that may be why they qualify for ADA paratransit services. Customers with disabilities have good days and bad days, and that can definitely have an impact on their experience using transportation in any form, whether fixed route, bus, rail, even ADA paratransit, dial-a-ride, etc. These are lots of challenges. And then safety can be an issue as well. Customers with disabilities may not always feel safe using public transit services, whether because of the service being provided or simply due to the nature of their disability, right? And then we have challenges facing operators and drivers. Operating a vehicle can be very challenging. Lots of competition for their time and attention. Customers do not always cooperate. So at times we have operators that may not be providing the required assistance. Well, at times we could have very challenging customers. Customers are not always appreciative, and that could be, I try to tell the staff that I work with that could be because they're having a bad day with their disability. And so we can't just sort of stereotype that some people are just always in a bad mood, right? And then things like equipment not always working, that can be quite a challenge as well. All of my work is promoting this concept of embracing the spirit of the ADA. We have some very specific regulations and you must do it exactly this way, but the ADA has many, many areas where the transit agency has choices to make. And depending on these choices, it often defines how services are to be delivered. And so if we take an approach of embracing the spirit of the ADA, I've believed and have seen the results that agencies many, many more times than not are making the right decisions with regards to assisting customers with disabilities and providing accessible public transit services. So we do have a requirement in the ADA that says that transit personnel must provide a reasonable level of assistance. There are actually a number of definitions, or terms I should say, in the ADA that are not exactly defined for us. What does reasonable assistance mean? We need to define that. What does seriously disruptive mean if we're talking about denying services to a customer? There has to be a seriously disruptive environment or situation or actions. How do we define that, right? Even we have a regulation that says we must provide adequate time for customers with disabilities and boarding and alighting, etc. So these are just a couple of examples of terms that are in the ADA that are not exactly defined for us. And so I help transit agencies understand these terms, and I suggest definitions for them, and then together we come up with sort of their final definitions for how these terms will be defined in their service. The ADA provides to us a definition of a wheelchair. That is a mobility aid that has 3 or more wheels, right? Usable indoors, designed or modified and used by individuals with disabilities. This regulation used to be much more specific years ago. It had the length and the width and the weight of a device, and that was replaced with a more broad definition of what a wheelchair, scooter, mobility aid can and should be. And so it's important that we sort of have a philosophy for how we identify, right? Some agencies follow very closely the minimum requirements of the ADA, and they really have no desire to provide services that exceed that. But most of the agencies that I work with, one of the reasons that they bring me in to work with their staff is because they are looking for opportunities, for approaches in order to meet the needs of their community. And for many communities, the minimum requirements of the ADA don't meet the needs for many of their riders. And so they want to develop a much higher approach to customer service, if you will, and provide a higher level of service to their customers. And of course, we have a variety of wheelchairs, scooters, powered, manual, but where challenges really start to come in is with securement. It can be very challenging for an operator if they're short on time, if they're not familiar with a particular device. These are the types of things that can be difficult and cause the boarding process to take longer than maybe has been expected, right? This is really where we have some issues. What are not mobility devices? If an agency very closely follows the ADA definition of a wheelchair, then things like, especially in the upper right there, it's a 4-wheel folding cart, that is, we might have customers with disabilities using that to help them with their balance, but technically it doesn't meet the definition. It does have 3 or more wheels, it does meet that, but it was not specifically designed for people with disabilities to help with their mobility, even though it may assist them with their mobility, and of course it carries their items for them. So this is one of those areas where I work with transit agencies to help talk through this issue and to help them not only identify what the minimum requirement is per the ADA, but what is a policy that will best support their community, right? I'll ask a question like, are you finding that many people are trying to board with these baskets or not? Do they block the aisle or the doorway? Are they creating unsafe situations on the vehicle? And so depending on the answers to this, that will often lead to us creating just the right policy for them. We also have customers with hidden disabilities, and this can be quite a challenge for customers with the hidden disabilities in particular. Unfortunately, in my experience, I have seen that operators often focus on whether they see that someone has a disability or not, but that's really not the right approach that we want to take. What we must do is to have an approach to providing assistance that sort of eliminates whether the person looks disabled or not. I like to suggest that we should just assume that every person has some kind of a disability, and therefore it really is unnecessary to identify whether they have a disability or not, and to simply focus on the assistance that is being requested. If there is a customer that does not appear to be disabled, but they ask, can you please lower the lift so I can board the vehicle, that is considered a reasonable level of assistance. They may have heart disease or diabetes or epilepsy, and they don't want to board in the front entrance using the stairs, or maybe if there's a ramp or etc. And so we need to make decisions on the assistance that we provide based on the type of request that is being made to us. This is the safest approach. I mentioned earlier, we do have a regulation about providing adequate vehicle boarding and disembarking time. And so is that 5 minutes? Is that 7 minutes? Is that 10 minutes? It really is in response to the needs of a customer. And so this can be challenging for operators who are trying to keep on a schedule. They have another pickup to make next. And so I suggest to operators that, well, they can offer assistance. Can I help you with this bag? Can I help you in boarding the vehicle? And then if the rider accepts that assistance, then they should ask, in what way can I assist you? How can I assist you, right? We need to understand not just that they want assistance, but in what way that they need assistance. Again, it could be grabbing the operator's arm or elbow, or it could be with the bag. So we really should not assume, right? We also have a regulation called reasonable modification of policy. This challenges agencies to modify any policy, practice, or procedure if the modification allows a customer with a disability to use the services. So it really comes down to, are they asking us to do something? Is it safe? And if it is safe for us to do, even if it is against our policy, then we should seriously consider providing that assistance. One example might be in paratransit, a customer with a service animal wants the vehicle to hold for a couple minutes while they take their service animal to toilet, right, to use the restroom. That could be considered changing the nature of the service, because our service is not to wait around, right? We arrive, we pick people up, we assist them as needed, and then we move on to our next trip, even in fixed route. But that might be a reasonable accommodation, especially from an operational perspective, where it might be easier to hold the vehicle for a couple minutes versus the vehicle leaving that customer there and then dispatching another vehicle later, right? So there are lots of examples of what would be considered reasonable modifications, and things that are not reasonable. Anything that creates a threat to the safety of others would not be considered reasonable, right? That could be asking for partial securement in paratransit, depending on your vehicle, but the agencies that I have worked with, virtually every agency requires the use of seat belts on their vehicles. And so someone in a wheelchair, that would mean securing the wheelchair fully, and that would also mean the use of their lap and shoulder belts. Some agencies might have a policy that states that they don't need their shoulder belt if it impacts due to a disability, maybe they have tubes, etc. But partial wheelchair securement, if a customer asks for that in paratransit, that is something that could be denied. That is not safe, right? Allowing a service animal to roam the vehicle out of control, right? Control does not necessarily mean using a leash. In my trainings, we go into great detail about that. So very important to understand those elements where they create an unsafe situation where we may be able to deny service. Then we have the direct threat denial of service guidance, which tells us that services can be denied to a customer with a disability if there are issues of violence, seriously disruptive, there's that term again, and then illegal conduct. But we must make sure that whatever information that we are using in considering to deny services, that there must be objective evidence. We make decisions in public transit, especially regarding customers with disabilities, using facts, using firsthand observations. And so we can't use opinion. We can't say, oh, I don't like that person, they look homeless, I don't want to board them. These are not acceptable practices in public transit, and that is considered to be a form of discrimination to deny services to someone who is not, especially creating a seriously disruptive environment. So we might have someone that has bad body odors, so we need to have that definition for what disruptive means and what seriously disruptive means, right? The regulation tells us we can deny service if there is a seriously disruptive situation. And I have defined that for my the agencies that I have worked with as disruptive means annoying and seriously disruptive means unsafe. So is it possible that someone's body odor smells so badly that the operator cannot safely operate the vehicle? Yes, that is a possibility. But we need to make sure that the decision made on that particular issue is made properly and is well documented so that the agency can protect itself if it needs to. I wish I could go into more detail on this because there is so much more to talk about on this particular issue alone, but please do contact me if you'd like to get a little more information. And then we have our service animals, of course. They are guide dogs, signal dogs, or other animals that are trained to perform work in support of a person with a disability. And there are many different types of service animals out there. I have seen, of course, dogs, miniature pigs, miniature horses, I have seen cats, and I have seen birds. That is what I have come across in my career. Is it possible that a snake could be a service animal? Well, there's always that possibility, right? Because service animals must be trainable. We have this portion of the regulation that says that service animals are individually trained to perform tasks. And so could a snake be trained to squeeze a rider's arm, let's just say if their blood glucose level was falling? Yes, and we have examples of that in public transit as well. Even in ADA complaints that have been filed that did deem that in that particular case, the snake was identified as a service animal. How do we recognize a service animal? Well, it's not based on how it looks. Operators love to focus, oh, it looks like a service animal, it's very obedient, so it is a service animal. Well, there's nothing in the regulation that says that they must be wearing anything or showing proof such as an ID. That does not determine a service animal. We may ask two questions. Is your animal required because of a service animal? And what task has your animal been trained to perform? And that's really it. Sometimes that second question gets operators in trouble because customers don't like to be questioned and judged, right? What task has your animal been trained to perform? But it is very clear that animals must be trained, and there was nothing in the regulation, if you remember, that states that they must be professionally trained, and therefore, yes, a customer with a disability may train their own service animal, and that does not necessarily mean training them to be obedient. And that's why I work with agencies to help focus on safety and to create an approach and how to identify whether an animal is acting in a safe manner versus an unsafe or seriously non-disruptive manner. A lot of confusion about what is not a service animal, but if we get down to it, animals that are not service animals have not been trained to provide any type of assistance. That includes emotional support animals. The support that they provide has been done so passively by nature. Just sitting in my lap is making me feel better. The animal was not trained to sit in my lap. And so an agency who wants to follow the definition of a service animal very, very closely will be having some negative interactions and will be denying services to customers that are disabled, but who may not have a trained service animal. And so I work with agencies to help make sure this is what they want to be doing. Do you really want to be denying services to a returning veteran who has PTSD and who has this emotional support animal and doesn't know the difference between, by definition, a service animal that has been trained and an emotional support animal that has not? So very challenging issue on that one as well. And so quick review, it's difficult for transit agencies to provide high quality customer service. It takes a lot of effort, it takes a lot of planning, right? It requires significant resources as well. And it is difficult for people with disabilities at times to use our public transit services. These services do not always meet their needs. There have been times in my career where I had to tell someone, I'm sorry, the type of assistance that you require goes beyond what we can provide you in public transit. The regulations are pretty clear that it is not a reasonable level of assistance for an operator to act as a personal care attendant and to provide any type of medical assistance. And so if that is needed, public transit may not be for a particular customer with the disabilities, but we are responsible as public transit professionals to identify and to remove barriers for customers with disabilities. So how do we address some of these issues? What is a solution? Well, in public transit, we need to provide improved and more frequent operator training. I help agencies improve and create their policies and procedures, and then every step down along the way. It needs to trickle down to their training programs and content, to their retraining, to how they reprimand and deal with operators that may be violating the ADA, not following accessibility policies. And we need to educate our customers, right? We need to create realistic expectations for customers, right? And we need to make sure that the level of service provided by customers with disabilities matches the level of expectation and needs that customers with disabilities have in using public transit services. And so I hope this information has been helpful. Would love to answer any questions during the question and answer period. Thank you all so much.
Thank you, Jess. Definitely some great information. So we're going to switch gears a bit. Our general manager, Michelle, will be interviewing our next speaker, Marco Pascua. Marco Pascua is an inspirational speaker, accessibility consultant, an award-winning entrepreneur, an accessible public transit professional specializing in ADA compliance, training, and mobility management. As an entrepreneur, he has remained focused on social impact, keeping a philanthropic approach to the work that he does. As an accessibility and inclusion consultant, he has worked with some of the British Columbia's biggest change-driven business leaders who are champions for more accessible and inclusive workplaces. It's through these experiences that he has helping to pave the way for all Canadians to have universal access to programs, services, and places they live, work, as well as play. Everyone, please welcome Marco Pascua.
Thank you very much. And I'm so thrilled to be here. And as the only Canadian, I hope you won't hold it against me.
Marco, thank you. I was going to highlight that, but thank you for joining us all the way from Canada. I appreciate you joining us. Could you tell the audience a little bit about your background and what you're currently working on?
Yeah, absolutely. So as you heard, I'm an accessibility consultant and inspirational speaker. I work mostly with cities and municipalities on inclusive employment strategy for persons with disabilities. And as you heard in my introduction, I've worked with some of the biggest change makers, both here in Canada and internationally, on creating more inclusive spaces for people with disabilities. Something that you wouldn't see from, necessarily just because we're in a fixed camera here is that I'm also a wheelchair user, and I was born with cerebral palsy. So I've had my disability my entire life. So this isn't just a profession for me because it's the right thing to do. It's something that I live with every single day. And the things that I've been able to witness and support organizations, businesses, and cities to recognize with the people that live in their communities is my life's work. And it's so wonderful to be able to uncover some of those things and provide independence for people across the country and beyond.
Thank you. Could you share some of your observations and thoughts on design accessibility?
Yeah, well, I think number one, when it comes to design and accessibility, we need to stop making it so that we have the individuals have to adapt to the technology, but rather the technology adapts to the individual. I know that sounds like a no-brainer, but I think that when it comes to the way in which we're now incorporating a lot of things, like, for example, this very meeting, this very event, the fact that I'm able to use virtual technology that has been designed in such a way that I, from Canada, can get up in the morning, get ready, get dressed, not have to worry necessarily about a physical commute and all the things that entails for me to get ready as somebody with a disability, getting out the door, wheeling myself to a bus stop, getting on the bus stop, now worrying about delays, worrying about things like that. When I arrive to the location, is it going to be accessible? The routes to entry and the entire journey needs to be considered. So instead of all of that, this morning I got up, I got dressed, I brushed my teeth, and I was ready to go. This virtual conference was here. So there is benefits to being able to provide virtual technology that, provide that sphere, as the first speaker spoke about. It's a new sphere of technology and being able to bring people in, but it's just as valuable. And having said that, nothing replaces the in-person ability to be able to interact independently. So I want people to remember that, because as we start to transition back into a world that's a hybrid model of our virtual world meeting our real world, we need to make sure that we're addressing the needs of people in the best ways possible so that they don't have to think, oh my goodness, am I going to be able to use the washroom when I get there? Or am I going to have to hold it for the next 5 hours because there's a set of stairs and I happen to be a wheelchair user? So having the foresight to design inclusively and think of the impact of how that space and place is going to be used by the people that are involved in it is so, so important.
Thank you. Let's see, can you talk a little bit about the difference between meaningful access versus accessibility?
Absolutely. This kind of ties in perfectly to the question I just answered, which accessibility means that, okay, so you have a ramp to get into a building and people can access it. But meaningful access is more around universal design. So yes, you have a ramp, but is it at the front of the building or is it at the back of the building near a dumpster, and it's raining outside and it's pouring and somebody has to be able to tap a doorbell and let somebody know, or it's a service entrance, which I've had even building operators tell me that it's a special tour that I'm being given because I'm being brought through the kitchen in order to get to the place where my friends and colleagues were able to enter through the front entrance. So, simply put, meaningful access addresses the real needs of the community. It recognizes that the whole is greater than the sum of its parts. It is generally code-based, but it's not code-centric, meaning, yes, it's important to follow code, but can you go above and beyond code to understand the ways in which people will be interacting in the space that, meet the needs of those individuals? And it considers the location, occupancy, site conditions, and the community as contributing factors to any given facility or route or space towards that facility. So, it's one thing to say, well, we met code, but for example, when I was in a hotel in Las Vegas a couple of years ago, I got an ADA compliant hotel room with my wife, and I went to go in to use the washroom, and I wheeled my wheelchair into the washroom, which was great. I could fit through the washroom door, but then when I turned my chair to look at the mirror, I could only see about the top half of my forehead and above. So I don't know about you, but the last time I shaved my face, that wasn't really going to work for me, right? Now, all they would have had to do, now they did meet ADA compliance by having that mirror in the position that it was in the height that it was in. But in order to go above and beyond and provide meaningful access, can that mirror be put on a swivel? Can that mirror be put on something that is detached or bracketed so that the individual can angle that mirror towards them and adjust it towards their needs or the height of their chair or assistive device? So we do have to think outside the box and really consider how people will be using the spaces.
That's fantastic. So what I'm hearing is inclusive design, considering the end users and a varied, diversified user group, rather than just simply code.
Yeah, get to know your community members. If you have a hotel, if you have a transit system, who are the people that use your system? What kind of issues have they run up against up to this point? Excuse me, the number of times I've gotten to get onto a bus and bus drivers have had to tell me, oh, I'm so sorry, the ramp is actually not working today. But it's actually because they just didn't want to take the extra time to lower the ramp and let me onto the bus because they know they have to strap me down. And maybe they're already late for their next bus stop. And there is stipulations with their operating team that if they if they miss their next deadline, that they're going to be reprimanded for that. So they're under this great deal of pressure of, what do? I want to meet the needs of the community, but I also want to make sure that I get to my next destination on time. So the number of times I've been straight up left at a stop, seeing that there is definitely an accessible space available for me, is just atrocious. And so I think that before we address the physical barriers of any environment or service, the number one thing we have to address is the attitudinal barriers, the understanding that that is not just some person in the community, that's somebody's friend, brother, mother, loved one, and leaving them out could be meaning that they're missing out on that next appointment that's vital for their health. And so understanding the story of how this impacts all of us, I think, is really, really important for service providers to remember that we all have a part to play in this.
So holistic and inclusive approach. And what I'm hearing from you is something that I've spent a lot of time on, which is the whole customer experience and living in their shoes from start to finish. Yes.
Yeah, 100%.
Thank you. What do you think the transportation industry can better incorporate and embrace technology, such as artificial intelligence?
Yeah, well, I mean, my goodness, just the technology that's in our phone today is greater than the technology that put man on the moon, right? So I think we have to understand that it's incredible that we have this type of technology in our pocket, but not everyone can use that technology by default out the box. There is accessibility adaptations that have to be made. App creators need to create applications that have alternate services, like being able to toggle on captioning if there's video services, being able to adjust the contrast or size of images so that people can be able to see it better if they have a visual impairment or some form of vision loss, to be able to dictate to them in some way if they're blind and they're using earbuds or a hearing aid or cochlear implant. So I think that being able to be thoughtful about how this technology is coming into play and what it can be used for is really, really vital. I will say this, Uber and Lyft are, really valuable services. Ride-sharing services are very valuable, but where they miss the mark is sometimes when they're making assessments about the communities that they're coming in, they're not necessarily considering the fact that there needs to be a universal rollout program of being able to provide that assistive training for drivers that are using their own vehicles to become more compassionate about community members, having that general understanding, right? So that training can be presented both in person and virtually. Or for example, wheelchair access vehicles, those types of fleets aren't by default within communities. And so then you're going to use Access Transit and other services to be able to provide those services, but it is atrocious. For example, in the city of Vancouver, where I live in Canada, we only got Uber and and lift services about 3 years ago. It took a lot to get past the taxi federations and some of the regulations for the taxi industries that are here because they didn't want their profits to be taken away. And then when those services were launched finally in our community, not by default did they have wheelchair access fleets or assistive training. To this day, you still can't use Uber and Lyft in Vancouver and have a wheelchair access vehicle or an assisted trained driver, period. So I'm a manual wheelchair user. I'm able to get in and use any regular vehicle, but some individuals in power wheelchairs and other devices don't have that luxury, don't have that option. And so if we don't have alternative providers with the technology that meets people where they're at so that they can plan accordingly based on their own abilities while utilizing that technology for trip planning, trip cancellation, addressing the needs, or being able to specify their specific needs. Maybe they will take a little bit longer to get dressed in the morning. If there's an opportunity to provide feedback or a comment to the driver in advance that this particular individual needs a little bit more time than the fixed 5 minutes because of this specific reason, now we're actually creating a communication pathway that makes sense. And communication isn't just audio or vocal. Sometimes that could be that a customer utilizes texting services because they aren't able to speak, right? So being able to provide those things, meet them where they're at, and have them have the dignity and respect and independence that they deserve is how I think we should really think about using technology moving forward.
Thank you. Okay, so what are some misconceptions people have about people with disabilities?
Oh, well, number one misconception is just because they have a disability, it means that they probably don't have gainful employment or they're not making a lot of money, which couldn't be further from the truth. I'm the CEO and founder of my own company and been running my own business for over 10 years. So the assumption that I am not going to have the funds to be able to meet somebody or to be able to use these services couldn't be further from the truth. Or that these individuals, for example, whether they don't have a job today doesn't mean these individuals can't be trained just like anybody else to be utilizing their skills to their advantage. For example, some technology companies have really found that working with individuals on the autism spectrum who have a really innate skill to recognize patterns or different sort of symbols or numbers is really key. For example, there's a program called the Autism at Work program that SAP, the global company, utilizes in training individuals who have an aptitude for programming to learn how to utilize their systems. And these individuals are some of the best bug finders in the system because they're actually using their disability to their advantage. So disability doesn't necessarily mean disadvantage. And so I want people to remember that you can actually have differing skills because of your lived experience that actually give you greater attributes than somebody who is what would be considered typical or somebody without any form of disability, whether it's visible or not.
Wow, thank you. Thank you. Okay, move on to the next question. What should the new goals or targets of transit leaders be regarding accessibility and inclusion?
Yeah, well, I think that rather than just looking at infrastructure development, improving, say, for example, the routes and paths of trains or buses or things like this, again, it goes back to that customer-centric focus. So understanding the communities that require your services most, does it make sense to have something like a monorail in your community versus light rail versus a bus service or an independent car service? Understand where the pinch points are for the people in those communities so that you can meet them where they're at. And Access Transit, from the sounds of it, does an incredible job of filling in those gaps and understanding sort of that future development and where we can go from here on out. I think that the more that we're able to utilize, for example, was mentioned off at the beginning of this event, things like autonomous drivers, and this is not to cut out the services of operators and say you're not needed of a job anymore, but rather how can that that device or that technology works symbiotically with the operator to make their life easier, so that it actually takes them out of the situation of those human error things, better routes to entry, better routes for travel, faster routes for travel, so that they can cut down on those delay times, so that they can account for those things and give that time back to the community, so that they're not necessarily rushing to make it to that bus stop or always missing that bus every single morning because of deadlines or stipulations in that regard. So I think looking at where we're going in the future with technology, with autonomous support, with how that can be integrated with operators, I think is going to be key, as well as the infrastructure in combination with how it's being used by the community.
Thank you. Thank you. Let's see here. COVID came and changed the world. Can you speak to the challenges and any opportunities COVID has presented to people with disabilities?
Oh, 100%. Now, I can only speak to my own personal experiences here in Vancouver, but I think there was a real misstep in our transit system here, and that was when COVID hit, because there's a lot of unionized environments and things of this nature. They actually, in our transit system locally here, had a stipulation around individuals with assisted devices and supports when it comes to safety protocols around COVID. And by that, I mean, in some communities, there's a type of bus where you can roll on if you're in a wheelchair and back in and put your brakes on so that you're not facing the direction of the driver, but facing away from the driver. And you don't then have to use straps or things of this nature because of gravity and the force of nature of the vehicle and inertia. But in some communities, we're using older buses where the lift comes down and you have to be strapped down traditionally to your bus and have assistance from the driver. Well, in those situations, which impacts my community because my particular community uses a lot of older buses, it meant that drivers were actually being told by their union and through this temporary procedure for assisted devices that they could be denied entry onto the bus simply because it was too dangerous for the driver to have to strap their wheelchair down because of the close proximity to them and that customer. And I thought that that was completely atrocious because if the person is wearing a mask and the driver is wearing a mask, they still require that independence. But I literally had friends in power wheelchairs, crutches, canes, and other wheelchairs and assisted devices calling me up crying, saying, I literally got left at the bus stop for the third time today because the driver said they didn't feel comfortable picking me up, even though I'm following protocol. And these kinds of missteps, I never want to see happen again, pandemic or not. I went on a campaign basically on radio shows, on television, saying how I was disappointed with these services. And, even today now, I think that the only way to make an impact in that is to have somebody with that lived experience to be able to have a voice at the table of some of these transit services. So I welcome all you operators out there. Consider on your board of directors having persons with disabilities on your board. Yes, they should have board experience, but they should also have lived experience so that they can speak to you about some of the missteps that were taken. I understand that safety is key, but I also understand that human rights and dignity come first priority in any situation, in any organization. And by having that representation live and on your board, I think it will help us to steer us in the right direction.
Thank you. Wow, thank you. You've given us a lot. I just appreciate your participation and your insight, and would love to engage all of our speakers further. But I do have to hand back off to Nathan. Would love to speak further with all of you. Thank you.
Awesome. Thank you so much.
Thank you for that wonderful information, Marco. Appreciate it. And we did run past a little bit of our time, but just before we go and conclude the session, I'm going to go ahead and ask a question for the panelists, Michelle, Karen, Judy, Jess, and then Marco. So pretty much this question is for everyone, and then we'll go in order. What is the one thing you want the audience to remember from today's discussion, Michelle?
Oh, let me hold on a second. I'll go back on camera. To be inclusive. to solicit input from everybody and to take advantage of technology. I like the idea of designing inclusively, but recognize that we also have a lot of outdated infrastructure, and that makes it twice as challenging, I think, or exponentially challenging. But I think it's to be mindful of being inclusive, incorporating feedback and soliciting feedback from peers, from end users, from our customers, and making open, flexible, adaptable changes.
Definitely. Thank you so much, Michelle. Appreciate it. Karen?
Thanks. And thank you for inviting me to be here today. It's really been a very stimulating and interesting discussion. All of the presenters were I learned so much today. If I would take away one thing or say there's one thing I'd want to sort of put out, there's been tremendous capital investment across the United States for decades to make our systems accessible. They are imperfect, but the only way we can get closer to perfection is by having people use those systems, give feedback, and to Marco's point, let the folks know who are in policy positions or be in a policy position to say, here's what could be different and better. Here's what works. Here's how we get more of it. One of the wonderful things about NJTIP is when we take a group of people on the bus, it's all the other riders seeing people with disabilities getting on the mainline bus and going, oh, I didn't know those people could ride on this bus. And I think that's really our challenge 31 years out from the establishment of the ADA.
Awesome. Thank you, Karen. Much appreciated. Judy?
Thank you. And I echo what others have said. I think inclusion is really important, and thank you for inviting me. I think if I was thinking about what I would want the audience to take away, it's spontaneity and choice. The services that we build need to be reflective of the needs of a diverse group of riders, so they have choice where they want to go, when they want to go. And only by having individuals with disabilities, older adults, and those with low income at the table as true decision makers are people going to realize that spontaneity. So thank you.
Awesome. Thanks so much, Judy. Appreciate it. Jess?
Tough question, but I would have to say consistency. So many agencies that I have worked with around the country reach out to me because ADA compliance fell from a priority, a high priority for them. And the only thing I can say to you agencies out there that operate services is that you can't lose sight of the ball. ADA compliance has to be woven into the fabric of the delivery of your services and the culture of your agency, which includes a commitment to quality information and training and retraining. And as soon as agencies lose focus of that because they think something else is more important or more pressing, this is when agencies get in trouble. And so that's the best advice that I can provide.
Thanks, Jess. And Marco?
I'm going to keep it short and sweet and say it's more of a personal connection thing, and authenticity around the connection that we're making with customers and with people that utilize our services. And that is people treat people like people. Regardless of whatever labels people try to apply to themselves, at the end of the day, we're all human beings with our own unique story. I like to follow the ways of Martin Luther King Jr., and that is judging a person by the content of their character and nothing more. He would say color of their skin, but I would say and nothing more. Who are they as people? Get to know your customers, make authentic, real connections with them to understand how you're impacting their day-to-day life by providing those services. It truly does go a long way.
Thanks so much, Marco. Appreciate it. And I just want to thank all the panelists again for your time and pretty much.
You're mute.
Nathan.
Oh, sorry about that.
That's okay.
Thanks so
That's so
much,
exciting.
Marco. But I just want to thank everybody today for their time and discussion with the pretty much discussing ADA services. So thank you. But that concludes my session. I'm going to go ahead and pass the mic over to Michelle.
Oh, I didn't realize I was closing out. Again, just want to say thank you. It's just so much incredible information. I'm thrilled that you all participated. I look forward to more of these events and exchanging information offline separately, but I would love to engage you further. I have a ton of questions that I'm not ready to ask now, being as we're running over, but I really appreciate your time and all of the different perspectives. Thank you so much. And a special shout out to Karen, because she's always my go-to. Thank you, Karen, as well as Jess, Judy, Marco, Nathan, Namika. I appreciate everyone participating. Thank you.
Thank you so much, everyone. Have a great day. And yeah, if you want to reach out, I'm sure you can find us, and our contact details are going to be provided to attendees afterwards.
Correct.
So I'd love to hear from you.
This wonderful. Thank you.
Thank you, everyone.
Thanks,
Appreciate it. Have a
everybody.
great one.
Bye,
Take
everybody.
care.
Thank
Bye-bye.
Have a good
Bye.
day.